Don't you think it's strange that a part of our body that we have to interact with multiple times a day is one that we were never really taught anything about? Insert your pelvic floor here. My name is Dr. Chris, and I'm a sport and pelvic floor physical therapist. And I didn't learn about this amazing part of my body until I was 29 years old, sitting in my first pelvic floor physical therapy course. I was both equally intrigued and excited, but also embarrassed that I was that old and just now learning about this part of my body. Why didn't we learn about this in sex ed? In today's video, I want to help demystify this part of our body, help you understand its 4 important functions, and also help you to appreciate the amazingness of your body in this particular area and help you not feel so embarrassed if you don't already know. Let's first start by orienting you to the anatomy. Here I'm holding a model of a pelvis, starting with the pubic bone here in front, the spine here on the back, and each half of the pelvis. Looking down inside of the pelvic bowl here, you can see the red structures on top, the bladder, the uterus, and the rectum here. I'm going to remove those organs to then be able to show you the pelvic floor in its entirety. So as I take these out, you'll see again, all of the red structures in the base of the pelvis here are the pelvic floor collectively. And they span all different directions to create a muscular hammock of support inside of the pelvis. In this way, it creates that hammock of support to hold all of the internal organs, as well as your intestines and everything else that lives inside of your torso cavity. On the bottom side here, again to orient, we have the pubic bone on top, we have the tailbone here. I want to point out we have the vaginal opening and then the external anal sphincter here. This is the other important layer of our pelvic floor as well. It works with the deeper layer that I demonstrated earlier. There's also a really important theme that runs across all 4 of them: flexibility. A strong pelvic floor is one that is flexible, meaning that it can contract and fully lengthen. A metaphor I like to use with my patients is thinking about your pelvic floor like a trampoline. If we have too much tension or too much laxity in the system, then that trampoline doesn't function well. Same is true for your pelvic floor. Now, I will be pointing out what do I mean by that more specifically in each of the functions as I go through them now. Number 1, bowel and bladder control. We need the pelvic floor to stay in a partially contracted position in order to allow us time to get to the bathroom. Once we're there, we want the pelvic floor to be able to fully lengthen in order for elimination to be achieved. If we have too much tension in the pelvic floor while we're trying to eliminate, that's going to make it really difficult for us to be able to have ease of evacuation of a bowel movement, i.e. constipation. It can also contribute to challenges with full bladder voiding, which can also create challenges with urgency or feeling like you need to go even though you just went. Conversely, if we don't have enough strength or a partial contraction in that pelvic floor when we're en route to the bathroom, that can really make it difficult to get there without leaking. Again, we need flexibility of this system, the ability to fully contract and lengthen to respond to each of these activities appropriately. Number 2, sexual intimacy. The pelvic floor needs to be flexible in order for intimacy to be comfortable and enjoyable. A really important piece is that when we have too much tension in the pelvic floor and specifically around the vaginal opening, this can make insertion both of a toy or a partner really uncomfortable. We need flexibility here for that insertion process to be comfortable, but also for the deeper pelvic floors to expand as well to make that achievable. Number 3, the pelvic floor is also a channel for birth. Clearly, we need flexibility in order for the delivery process to be most easily achieved. If we have too much tension across the pelvic floor and around the vaginal opening, then that's going to make the delivery process that much more challenging. This also contributes to an increased risk for pelvic floor injuries if we have too much tension in that system while we're trying to deliver a baby. Number 4, the pelvic floor is also part of our deep core system. It works with our abdominal wall, the deep spinal muscles, and our diaphragm that lives inside of the base of our rib cage and helps to control our breathing. All of these muscles collectively create our core team. The pelvic floor is part of that and is literally the foundation of that core team, and its primary job is to act like a shock absorber when we are in motion. So as we walk, squat, run, our pelvic floor is constantly oscillating, like that trampoline analogy, to be able to shock absorb while we move. That's what allows us to be able to move well. If we don't have a flexible pelvic floor in that case, then this contributes to pelvic floor symptoms and can also create challenges for the hip and low back as well. With all of this in today's video, I hope you also remember the importance of flexibility in that pelvic floor. That's what keeps her strong. Follow along in our next video where I'm going to be discussing how to actually do a pelvic floor contraction, aka the Kegel, and also how to do it properly while performing your day-to-day activities so that there's actual carryover into functional practice. So, hope this video helped to debunk and demystify the pelvic floor for you, and I look forward to seeing you in the next video.